Welcome to the next video on how to be an effective volunteer. So here we're going to talk about effective communication that you're going to have with your client and the effective role of a therapist. You need to be generous with your words, and it's about verbal communication that you need to build with your client or your patient and the kind of right silences that you need to have between your therapy. While keeping in mind your words and while keeping in mind the kind of verbal communication that you build with your client, you have to make sure that you also give right pauses when needed and you do not do much of talking. You need to let your client talk and you need to maintain a gap between two, three things that you're saying so that there is no confusion. You do not need to ask any leading questions which might hurt the sentiments of your client. The comments that come from you as a therapist have to be in a tone which is expressive, which is compassionate, which is warm and generous. While talking to your client, make sure that you do not lead them away from the kind of topic that they're talking about. You do not lead them away from themselves. You need to let them come and talk about themselves more than any other people that are involved in their story. Of course, ask them questions which involve what makes them feel bad, but do not make them focus on other people, but rather bring them closer to themselves in a touch where they feel that they are bonding towards themselves and also building a future for themselves. While the client talks about their problem, you do not need to lead them away from the content that they're sharing. You need to make sure that your responses are in agreement with what they're talking about. You do not need to ask them questions that lead them somewhere else apart from the topic they're talking about. And also make sure that the kind of discussion they're having with you is led by you towards themselves and not about other people. Do not make them revolve around other people, but their own problem and how they feel about it rather than talking about other people. While clients are taking their time out in therapy, while they are maintaining their silent breaks in middle, please let them take it and do not ask them any leading questions at that time, because some clients do take their time out and do need to think what they need to say next to you as a therapist. So you need to encourage them to take their right kind of pauses and do not ask them any leading questions at that time which would fiddle their mind and also which would cause some disruption with their thoughts. An effective therapeutic session involves the right kind of inquiry that you make during your session, and it involves right kind of guided discovery that you do with your client. Also, you need to ask open-ended questions rather than closed-ended questions, because open-ended questions will involve more discovery into the client's problem rather than closed-ended questions which will end of an answer with yes or no. Open-ended questions always begin with what and how. They never begin with the why. Why questions are very leading and why questions are very disrupting for the client, because they can lead you to a level which is very personal in their life. Do not ask questions with a why and do not ask close-ended questions, because they will usually end with a yes or no. So avoid asking close-ended questions. The previous video was an example of how you ask open-ended questions and how you do not ask leading questions and how you do not ask why questions. So here in the previous video, as you saw, when the client came in to talk about her relationship issues, the counselor always began with what and how and did not begin with the why.